Hello, this is Dr. Ade again. I've been told not to use my hands so much, so I'm going to hide it under the table. Today I'd like to discuss medical ethics with you and medical dilemmas, more importantly. Most doctors, all doctors' first priority is the patient's best interest. We want to look after our patients, we do the best we can for the patient, and the patient is number one. One of the dilemmas we face is in giving a terminal diagnosis. If you're going to give a terminal diagnosis, you want to make sure the patient has family, the patient's family is there. They don't necessarily have to have family, but if they do have family, it would be nice for the patient's family to be there so that you can answer all the questions. Now, in some situations, the family would state, "Oh, please don't tell the patient that they're terminally ill." What would you do under those circumstances? Could you write it in the comments for me so that we can start a discussion on this? It's a very difficult one. Most doctors would act in the patient's best interest, like I say again and again, because the patients came to you with symptoms. They want answers as to what's going on. Now, in some circumstances, it would be the patient that would say, "Don't tell my family that I'm terminally ill." In that case, it's relatively easier in that you have to respect the patient's wishes. If they get unwell and need help, really unwell and need help, then you can have the discussion again. You can review that discussion time and time again. And then the patient might change their mind and you decide to tell the family because they need support at that stage. It's a very interesting topic. There are other situations that can cause medical dilemmas again as well, and that's when it comes to breach of medical confidentiality, patient confidentiality. If the people around the patient's spouses are not aware that they have communicable disease, what do you do? That's another dilemma. Because the patient is your priority, you have to act in your patient's best interest, not necessarily the spouse who you may not know. However, that might override in this situation. You will have to encourage the patient to inform the spouse that they're unwell, and if they don't, you have the right to actually contact the spouse, bring them in with the patient and discuss it. It's nice to talk to you again. Thank you.